Hi, Ann and Taylor from Radiance to answer some commonly asked questions about filler. So, what is dermal filler?
Dermal fillers are hyaluronic acid-based gels that are used to restore volume and to smooth fine lines and wrinkles.
How long might I expect this treatment to last?
This varies depending on the area treated, the individual treated, and the result that they would like to maintain. In a general sense, you can expect 6 to 12 months once we have achieved your desired outcome. We'll reassess during this time to see if more treatment is necessary.
So, I'm a little bit worried about pain. Is it going to be painful?
We try to make this treatment as comfortable as possible, providing you with a variety of numbing choices along with distraction techniques.
So, I have this special event. Should I come in and get dermal filler right before that event? What is the downtime like?
Some common side effects include mild bruising, mild swelling, and some tenderness. These usually resolve in a few days, but may last up to a week.
How do I know how much filler I need, where I need it, and if I'm a candidate for it?
We offer a complimentary consultation in which your provider will assess your face, review medical history, and recommend a treatment plan based on the assessment findings. We treat every patient as an individual, considering their unique features and anatomy. Facial balancing is an important aspect of the assessment process in providing natural results that enhance the patient's natural features.
Are dermal fillers permanent?
Dermal fillers are not permanent. We have a product that will break down the filler if needed. Otherwise, your body naturally will break down these products over time, which is why you need maintenance treatments to maintain your result.
If you have further questions about filler, please schedule a consultation with one of our providers to learn more.